cyclophosphamide, cytosine, arabinoside, and asparaginase. Just pronouncing all these medication names can already make you feel a bit dizzy. Don't worry, soon you'll become real experts in your personal chemo treatment. Until then, let's go over the most important basics you need to know about chemo medications. To start with, you really only need to remember one technical term, and that is cytostatics. This is the umbrella term for all the medications used in chemotherapy to treat cancer. Translated, it roughly means cell stoppers. In line with the motto, stop, this far and no further. The cancer can no longer grow, and more than that, the tumor cells are so severely affected that they break down and die. Most patients are not given just one cytostatic drug, but several at once. It's basically a kind of combination where you mix this one and this one and this one. Over the course of treatment, that can easily add up to a few dozen different drugs, and often multiple cytostatics are administered at the same time. This is because the individual substances affect different processes within the cells. What exactly happens in detail is quite complicated, yes. But basically, in one way or another, it leads to the cells no longer being able to divide and eventually dying. Now, tumor cells are not all the same, right? That's why, as mentioned before, not all of them respond to the same cytostatic drug. In addition, some tumor cells are temporarily in a kind of resting phase and are protected from chemotherapy. That's why chemotherapy has to be repeated multiple times and different cytostatic drugs have to be combined. And we don't just do that randomly, but according to very specific criteria and a fixed sequence. So we say this one first, then that one, then this one, then that one again, then that one in between, then this one, and so on and so forth. That means there is a very specific order that has been determined in advance. Doctors refer to this as a treatment protocol or treatment regimen, so everything follows a precise plan. Unfortunately, the effects of cytostatic drugs don't come without side effects, and that can make chemotherapy quite exhausting at times. That is because the medications mainly target the cells in the body that divide very rapidly, and that unfortunately also includes some healthy cells. That means the ones that grow particularly fast, like in rapidly growing tissues such as the skin, hair, mucous membranes, and also the blood-forming cells in the bone marrow. Not every patient necessarily experiences all the possible side effects, but rather, specific medications can cause specific side effects. This also varies greatly from person to person. That's why the doctors at your ward will explain in detail what potential side effects you might have to expect during your individual treatment. But that doesn't mean that all of those effects will actually occur, because every person reacts a little differently to chemotherapy. The good news is that many side effects such as pain or nausea can be effectively prevented or treated effectively. And these sudden reactions also disappear once the treatment is over. This is because healthy cells are much better at repairing the damage caused by chemotherapy than tumor cells are. If you'd like to learn more about the individual side effects, then take a look at the videos on this and related topics so you can get an idea of what to expect and what else you might want to know. Click through them and make sure to ask questions and have things explained to you by the doctors and nurses first.